LPGN. It is my pleasure and my very great privilege to be here today to introduce all of you to a very esteemed group of doctors. Each one of them is a member of our LPGN Scientific Advisory Board. These doctors have all committed to helping LPGN in the research, development, and the authentication of our entire product line. They help conduct studies that show the efficacy and the results of LPGN products, and they also brainstorm together to best add unique formulas to our line of healthy living products. Today, they're going to help us answer some of your most commonly asked questions about our products, about nutrition, and alternative ways to achieve health and wellness. So please, help welcome to stage Dr. Bjoedne Eskeland, Dr. Edward Andujar, and Dr. Hitendra Shah. Now, before we get started, I have just a quick little Laminine testimonial endorsement for you. Dr. Eskeland just had back surgery less than a week ago, and he was able to travel all the way from Norway to be here with us today. Thank you, Laminine. So, Dr. Eskeland, we're going to start with you this morning, and we'd like you just to take some time this morning and share with us a little bit about your background, your research, and sort of how Laminine came into being. What is Laminine, when you just talk about it in terms of your body of work?
Yeah. Okay, sure. I have been working with the product from fertilized chicken egg for many years. For over 20, I think it's 22 years, started in 1992. But previous to that, I did a lot of studies on egg and egg chemistry. And when we evaluated the protein quality of different foods, we used the egg protein as a reference. That means that it was 100% bioavailability. And when you think about it, an egg, has all the nutrients required to make a chick. And after so short time as 23 weeks, you have a complete individual or a chick that can manage on its own. So the metabolic activity taking place in the egg in the early embryogenesis is unbelievable. But then we didn't have any commercial production unit. We only produced for experimental purpose. The first study we had was at the Red Cross Hospital in Oslo, where we had middle-aged men missing sexual desire. And we improved that very much, after only 2 weeks. And when we look at the hormone level or the testosterone level of those individuals, those with a very low testosterone level, we actually normalized that. So the study, we did another study at the same hospital a couple of years later, but we did not have any production unit that we only produced for experimental purpose. And later on, that was one of the ingredients. Then we have to look at other ingredients that will fit the product more, like coming up with the Laminine later. But we had also a lot of studies in memory, and we had 44 person in middle-aged person from 54 to 79. And we actually increased using the California verbal memory test. We increased that by almost 20% unit after 6 weeks on Laminine. And we had Dr. Kjell Torblom at the University of Denver. He did some study. He's a friend of mine. He did some study on young athletes with very, very good research. They increased their bench, muscular tissue. Recently, we have done a lot of. We know as we age, we lose more and more muscular tissue. From 50 years to 75, we lose about 1/4 of 25%, approximately 1% a year. And this is why when we become old, we become more weak. We don't have the muscular and even the strength. So actually, the reason when we look at the cortisol level, as we age, the body produces more and more cortisol. An old person close to the death, he will have extreme high level of cortisol. Some people call it actually death hormone. But actually we need a little bit, but most people on a regular basis, they go around being stressed and they have higher level of cortisol than necessary. And Laminine is a fantastic product to reduce that cortisol level.
Okay, so based on some of the questions I know you received from your customers and your team members, would this be a video you'd like to see posted on the LPGN website? All right, well, I got a couple ins at the home office, so we'll see what we can do, and we'll get that posted so you can refer people to take a look at that, because we know how important sourcing and processing is to you. So we're gonna now go to Dr. Shah and ask him a quick question. Dr. Shah, what research and studies are being conducted on Laminine and Laminine Omega-3 Plus, and when will they be available?
I have been using Laminine and Laminine Omega for the last few years in my clinic, and I see good benefits in the form of increased energy, blood values, more relaxed, reduced stress, anxiety. And I was talking to Dr. Andujar regarding this, and he said, let's do some studies so we can validate the findings. We can see this anecdotally, but if we can validate it, it's much better. So we asked some of our patients if they would like to participate. And I think Dr. Andujar will be able to tell us what we found, and it's a very exciting finding. We'll be very happy to learn what we did.
Well, later on I will be explaining the study in its entirety. It's completed and all the results are done. We have all the data. I just want to say that I want to thank Dr. Shah, because very early on, when we try to recruit patients for any medical study, it's always very difficult, and you end up losing patients along the way. And then there's patients who don't necessarily want to be on a supplement. With his group, and since he is more of a clinical physician who has an alternative practice, a lot of the patients wanted to be on the supplement to try to help their cholesterol and blood pressure. Whereas when we first started talking to them, I was surprised at how fast it was easy to collect the patients.
Because they had seen good results with it anyway. So they were very happy to participate in the study.
And the patients that we worked with, what did you find that they really enjoyed? Was it the cholesterol level and the blood pressure?
He'll be able to discuss the findings in detail tomorrow. But we found improvement in most of the parameters in the blood, which includes the cholesterol, triglycerides, blood pressure, even blood sugar, and even hemoglobin A1C. Their overall improvement in the health itself was very noticeable. And we did detailed study, including the cortisol, what Dr. Eskeland said. The biggest problem we face as we age is our cortisol level goes up, and another problem is anxiety and stress, which also causes all different problems. And what we found, he will discuss tomorrow, that it has a good benefit on the cortisol level as well as the serotonin level.
Mm-hmm. Do you think that's why, Dr. Eskeland, that these patients felt better? The effect on the serotonin and the effect on the cortisol?
Absolutely, because the first thing they report back is that quality of sleep is so much improved.
And that has to do with the increase
in serotonin.
And the decrease in the
cortisol, of course.
So most of us, majority of the patients, the traditional doctors, when they go to the, all the patients, when they go to the traditional doctors, they always diagnose them as anxiety and stress and put them on anti-anxiety or antidepressant medication like Paxil and Wellbutrin and all those. They work on the serotonin, but none of them increase the serotonin level. This is the first time we have found that it can definitely increase the serotonin level, and it has good benefits because of that.
And what you're saying is, if you all are going to a doctor, he's going to give you a medicine which has side effects to affect the serotonin. Well, you don't need it because the Laminine does it better. And you have no side effects.
That's so true. That is so true. Well, I think it's going to be really important to make sure that everyone is in the room tomorrow, because that's when, I mean, little spoiler alert, that's when the doctors are going to be discussing the results of our most recent clinical study. So Dr. Shah, I'm going to turn it back to you briefly, just switching gears a little bit. What would you say the main things are that people can do to help slow down the aging process and really live a healthier lifestyle?
The most important thing we do is, first is a diet, increase vegetables, more fruits, less meat, especially grass-fed organic meat and dairy, more sleep, at least 6 to 8 hours of sleep, and regular exercise, 20 to 30 minutes a day. And in addition, now probably we can take Laminine and Laminine Omega, and that will help us with the anti-aging process.
And that aging process, like you said, has a lot to do with the cortisol, because I believe you told me that the highest registered cortisol in someone is really when someone's about to die.
Yeah, that's true. When we measured that, it was like 3-4 times higher cortisol than in a younger person, you know.
And by taking Laminine, we can keep the cortisol down and stop that aging process, or at least alleviate some of the problems.
In that specific study, we reduced the cortisol level 50% in those individuals.
See, in our regular lifestyle also, it's all stress and anxiety. You're going to the work, everywhere. There is some stress and anxiety. And any stress and anxiety increases the cortisol level. And that affects the body adversely, you know. And if you can control the cortisol level by natural means, I think there's nothing better than that.
So I'm sorry, Dr. Shah, go ahead.
In Eastern medicine, they do yoga and breathing exercise and pranayama and meditation. That all helps. But if we can add this omega, Laminine and Laminine Omega, that might be much more beneficial also.
Well, the whole purpose of yoga and meditation and so on, the end result, again, is lowering the cortisol level. And that's what Laminine does.
So, Dr. Andujar, what happens if you take Laminine for a couple of years and then you stop? Does your body suddenly start showing the signs of deterioration and aging faster?
Well, you know, people say, they'll ask me, well, do I have to take Laminine the rest of my life? Well, you're going to keep aging the rest of your life, every day. So if you don't take the Laminine, then the aging process is going to be faster. We want to slow down the aging process. So to slow it down, we take Laminine because it lowers the cortisol. And it's a natural supplement that doesn't have the side effects that you can get from other medications.
But whatever the benefits you have achieved by taking the Laminine for a year or 2 or 5, it still stays. It doesn't go away just by stopping the medication. And afterwards, aging process may start, but it may not be probably the same level.
Okay.
Yeah, I think you and I were talking about the fact that when you first start taking the Laminine, there's this increase. And then eventually, when you get to the effect that you want, there's a plateau. And that's the plateau, and that's when it's giving you the best effect. And you want to stay at that plateau. Now, if you stop it, it's slowly going to start to go down again. And then when you start taking it, and you say, oh, I better start taking it because I'm not feeling that good, it's going to take a while again to get up to that plateau and then give you the desired effect.
Exactly. You don't want to undo what you've done.
Exactly.
That makes so much sense. So let's talk a little bit.
Let me just talk about what Dr. Eskeland said about the study they did on the mice. According to him, the mice lives for about 2 years, right?
Yeah.
And they gave this Laminine to mice at year and a half, 18 months?
Yeah, about a year and a half.
Right. And they found that these mice did not age. They did not have any fat in their abdomen, and they had excellent blood vessels. There was no atherosclerosis.
Now, let me just say, those mice that he's talking about, all they ate was Laminine.
Yeah.
And they could eat as much Laminine as they wanted. They did not eat any commercial food at all. All they ate was Laminine.
For 6 weeks.
For 6 weeks.
For 6 weeks.
In 6 weeks, they found so much benefit.
Yeah.
It's unbelievable, you know.
Okay, so let's talk a little bit, and I know this is a relevant question to many of us in the room. Dr. Shah, let's talk a little bit about Laminine and the effects it has on a person's hormone levels and hormone regulation.
As Dr. Eskeland said, as we age, one of the reasons for aging is most of our hormone levels start declining after age 30. So at age 50 or 60, if it is half the normal level, we develop all the different symptoms of low hormones. In traditional medicine or in the alternative medicine, they prescribe bioidentical hormones and the regular drug medications.
And all those medications have side effects.
They have side effects. Now, as the study says that if you can improve the testosterone level naturally by Laminine, it has so much beneficial effect. In women, especially more important hormones are estrogen and progesterone. And that's the low level of estrogen and progesterone can cause the perimenopause and menopausal symptoms. And if we can control that without taking medication, without much side effect by taking Laminine, I think it is much, much better.
You know, when I was practicing medicine clinically, the only time that a woman would come in with her husband is during menopause. And the husband would say, "You've got to do something, doctor. I cannot live this way. She has changed. She's a witch now." It all changed.
Let me tell the other way also. So many women, you know, most of the men, they never like to go to the doctors. And the women, they come to us and tell, "My husband is acting like this. He's irritable, he's moody, he's grouchy, he has no interest in libido, sex." Or so many other symptoms, but man says they're always normal. They never complain, you know. But then when they come, now there's a new term called male menopause. It's also called andropause. Now what we find that men also, as we age, is just not limited to the woman. Our hormone levels also decline, and that causes all different symptoms like anxiety, irritability, less motivation, low libido, all different symptoms. And we find that our testosterone level and other hormones decline. And if we can balance those things with the natural things, there's much better than taking the medication or the drugs.
And that's with natural bioidenticals. We do not want people, I mean, the treatment right now actually is testosterone injections. Ow. And along with the testosterone injections are a long, long list of real bad side effects. So you always want to stay away from the traditional medicine, especially for the men and the testosterone injections.
That's right.
Gosh, the women have the babies, they have to take a shot. Ow, really? Oh my goodness. Dr. Shah, with your background in traditional Western medicine, what is it about alternative modalities that is appealing to you in your practice?
In traditional medicine, most of the time when the patient comes, we look at the symptoms and we try to prescribe something to control the symptoms. Like if somebody comes with the stomach pain, or take this Nexium. Somebody comes with the joint pain, take this Motrin or ibuprofen or something. These symptoms-oriented medication. Even if somebody has a high blood pressure, we give the medication to control the blood pressure. We don't look at the cause or the reason why the things are happening. In alternative medicine, or what we call it, it's not exactly alternative. What we call it is a complementary or integrative medicine, where we try to look for the cause of the problem. And if you can remove or reduce the cause of the problem, the results are much better and the patient has less side effects and they feel much better.
And like you said, it's really complementary, integrative, where you use some traditional views and some traditional medications along with the natural supplements.
As long as it's necessary, we continue with the, like somebody has a high blood pressure or high blood sugar, we can continue with the medication what they're taking. But when we use some alternative supplement, and as it comes down, we can reduce the medication or we can even stop it at some point. And here we don't use the, FDA won't let me use the word cure, but many a times by good alternative integrative medicine, we can literally reduce or cure the problem by taking the supplement.
It's always been the same thing. Doctors wait for you to have a problem before they see you. where natural supplements are given to you to try to avoid the problem. And certainly we would like to avoid something than try to treat it afterwards, because if we treat it afterwards, then you have a side effect to the medication, and I got to give you another medication and another medication, and it never stops.
So, Dr. Andujar, along those lines then, why does it take some people longer to experience the benefits of Laminine and Laminine omega-3 plus than, some folks feel, I've heard endorsements where people say they took it in the morning and by that evening they were feeling fantastic, and then some people say it takes a little bit longer for those effects to kick in.
Well, the natural process of aging takes a while, and the different organs in the body work differently. And it all depends on when you got the problem, and it depends on your age. So, for instance, with me, it was my knees from all my years of kickboxing that started to bother me a lot. So the first thing when I started taking Laminine, and it did take about 3 weeks before I got total alleviation of the problem, but it'll work on one part of the body, then it depends on the area of the body and the amount of aging that already took place. So then, say your joints were fixed, but then you have a problem with memory, and then it may take some time before it actually affects the memory. But it'll jump to different areas where it's needed the most. So your body will try to heal itself with the aid of Laminine. Now, there's 3 areas that can stop Laminine from working or decrease the amount of actual effect. First, it could be poor circulation, it could be bad digestion, and if you have a compromised immune system, then it won't work at all when it gets to the organ. So poor circulation, we've been able to help by using Laminine omega-3 plus. The bad digestion can be helped by increasing the absorption of Laminine.
See, that's what I find, that when you take Laminine with any supplements or anything, it improves the efficacy of the other supplement also.
And then the third group is, of course, the immune system, which can be helped if we find that we can boost the immune system with the immune factors.